Thank you for your interest in learning about VIA's Exploring Healthcare program. My name is Lina, and I am the director of the Exploring Healthcare program. First, let me tell you more about myself. My name is Lina, and I was born in LA to Japanese parents. Then at age 3, I moved to Tokyo and attended a public Japanese elementary school for several years. Then at age 8, I moved to Singapore and attended Singapore American School. Then I returned to Tokyo and attended the American School in Japan for 6 years. And then in my last year of high school, I moved to Manila in the Philippines and graduated high school from International School Manila. For university, I attended Oberlin College, which is a small liberal arts college, and majored in biology and environmental studies. Then I moved to Boston and received my master's degree in education at Harvard Graduate School of Education. Then I worked at a small nonprofit organization, or NPO, in the Boston area called Primary Source, where I was teaching teachers how to teach and doing work on global education. Then I moved to California and received my PhD in education at the University of California at Davis. In 2017, I started working at VIA, where I have been since. So that's almost 4 years now at VIA, serving as the director of healthcare programs. So I wanted to tell you about this journey because I wanted to convey the idea that international education is something that's very important to me, both personally and professionally. And as program director of the Exploring Healthcare program, I seek to broaden participants' minds and introduce a variety of perspectives. So that's a little bit about me. Now I want to tell you a little bit about VIA, the organization. So about VIA. VIA was founded at Stanford University in 1963 as volunteers in Asia. VIA sent Stanford University students to Asian countries to do volunteer work there. Then, starting in 1977, VIA began programs for students from Asia in Silicon Valley. And so since then, VIA has been engaging in bilateral exchange, sending Americans to Asia and bringing Asian students to the US. VIA is a nonprofit organization based in the San Francisco Bay Area, and we currently have 7 staff members and over 10,000 alumni around the world. VIA offers programs in the US, Indonesia, Japan, Myanmar, Thailand, and Vietnam. Now I want to tell you a little bit more about the Exploring Healthcare program. First, I want to tell you about the goals of the program. There are 5. The first goal is for participants to critically examine healthcare systems in the US and Asia. During the program, participants will have a chance to compare and contrast healthcare and health insurance in the US and Asia. A second goal is for participants to broaden their awareness of unique medical issues faced by patients from diverse backgrounds. A third goal is for participants to explore the intersections of healthcare and social issues. And in particular, COVID-19 will be used as a lens through which to explore these intersections. A fourth goal is for participants to gain insights and mentorship from a wide variety of healthcare professionals. And the final goal is for participants to determine what kind of healthcare professional they want to be and to expand their network. I now want to tell you a little bit about what a day during the virtual EHC program may look like. So in the morning and early afternoon, Asia time, there will be either a panel discussion or interactive workshop with guest speakers, group work and discussions with fellows. In a moment, I will explain who the fellows are and what they do. There will be some independent work where participants will be reading articles or watching videos on their own. And then in the late afternoon and early evening, Asia time, there will be individual reflection on the day. So during the program, every day, participants will be learning a lot. And so it is important to take a step back and reflect on what was learned. In addition, there will be optional activities for deepening connections among participants. So this is what a day of virtual EHC may look like. Roughly speaking, each day will begin at around 8 a.m. Japan time and ending around 1:30 p.m. Japan time, or around 7 a.m. start time for mainland China time, ending around 12:30 China time. So this is what a morning session will look like. This is a photo from the most recent program. So again, this will all be done via Zoom. I also wanted to say a little bit about who the guest speakers and panelists will be. So they may include current medical students at Stanford and other medical schools, former EHC fellows who are alumni of EHC or American medical students, organ recipients and family members of organ donors, and a variety of healthcare professionals from doctors to nurses and social workers. I also wanted to share with you some of the topics that we will be exploring during the Exploring Healthcare program. These topics include medical education, organ transplantation, mental health, palliative care, health disparities, role of the government and cultural values in healthcare, and post-COVID-19 healthcare. As I mentioned earlier, COVID-19 will be used as a lens through which to explore healthcare and social issues. So earlier I mentioned fellows. So fellows are part of the program staff team, and they play an important role in running the program. One of their critical roles is to facilitate small group discussions. So each participant will be assigned a fellow, and every day during the program, you will have multiple opportunities to meet with the fellow. And in groups of 3 to 5, depending on the total number of participants will get to share ideas and reflect on the day's activities, practice speaking in English in a small group setting, and gain confidence. I know that speaking in a large group setting can be anxiety inducing. So the small size of the fellow groups is designed to give participants more confidence. Participants will also get to work with one another in their fellow groups to practice reflective writing and build friendships. I also wanted to say a little bit about the online platform that we will be using. It's called Crew. And using this platform, we will be sharing details about the program schedule and resources. And there will also be discussion forums for participants to engage with one another. I wanted to say a little bit about the program logistics. So the duration of the program is August 8th through 14th, 2021 Asia time. And the program participation fee is $900 US. This includes 30 plus hours of live online presentations, discussions, and interactive workshops, guest speakers and panelists representing a variety of healthcare fields, and access to the online platform, which I just talked about earlier. The program might be right for you if you have a busy schedule and are looking for something with less time commitment and more flexibility than an in-person program. If you want mentorship from peers and a variety of healthcare professionals without traveling far. If you want to discuss a variety of healthcare topics, including COVID-19, related social issues and current events. If you want to form friendships across cultures. And if you want to practice English in formal and informal settings. So I invite you to consider these reasons. And if one or more of these reasons resonates with you, I encourage you to apply to the program. Now I want to tell you a little bit about the application timeline. There are 2 rounds. The first deadline is May 24th, and the second is June 21st. The only difference between these 2 deadlines is that if you apply by the first deadline, you're more likely to be accepted. However, if you are currently busy and you would prefer to wait until round 2 so that you can submit a more complete application, then that would be perfectly fine. So please consider your own schedule and determine which round will be better for you. So if you apply by round 1, interviews will be conducted via Zoom in English from May 25th through June 3rd. And if you apply in round 2, The interviews will be done from June 22nd through June 27th. Results will be announced by June 5th if you apply by round 1, and June 29th if you apply by round 2. And you will need to confirm your participation by June 12th if you applied by round 1, and by July 6th if you apply in round 2. I've spoken a lot, and now I want to share with you some voices of alumni. The first person that I would like to introduce is Eiko Osasa, who is an alum of the Spring 2018 program and was a fellow for the Spring 2020 program.
Hello everyone! Today's topic is my favorite point about EHC program. I'm Eiko, 5th year medical student. I participated in the EHC program 3 years ago. Today, I talk about my favorite point about EHC program. My first favorite point is to discuss medical topics in English. It is very valuable experience to be able to talk about medical topics with native speaker while in Japan. There are many online English conversation classes, but there are very few opportunity to learn about specialized medical topics. Question: in the current severe corona situation, do you have an opportunity to hear directly from organ transplant survivors and the donor families in the US? Let's think in time. The answer is no, but with EHC, you can do it. My second favorite point is to expand your network. Discussing with Stanford medical students is a great opportunity to learn about the differences between Japan and the US. With EHC, you can do it at home. Stanford friends I met in EHC program keep in touch with me. Last month, we had a discussion about the COVID-19 vaccine in Messenger. And EHC Japanese friends are very motivated, so we can exchange information after graduation. This photo is Zoom alumni party. We really enjoyed it. Let's expand your network at home. You can make a lot of motivated friends with Stanford medical students and many Japanese friends. With EHC, you can have a study abroad experience at home. No perfect English, just only your courage to step forward. If you're interested in EHC, please check it out. That's all. Thank you for listening. Bye.
I also want to share with you some testimonials from the most recent cohort because they experienced the online program. And you may be wondering, what did participants actually gain from an online program? So one alum wrote, "It is a super rare chance to share your dreams or ideas with other high-level students. And you can also get a chance to make progress in your English skills." Another alum wrote, "EHC introduced me to people with various backgrounds, interests, and fields, and there were many new ideas and perspectives that made my eye open. It is a great opportunity to be brave and educate yourself." And one more testimonial that I would like to share with you is this alum who wrote, "If you want to participate in this program but are not confident in English and are wondering whether to participate, you should participate. Many of the participants want to improve their English skills through this program. Don't hesitate to participate in this program." If you have any questions at all about the EHC program, please don't hesitate to contact me at lina@viaprograms.org. I am fluent in Japanese, so if you would prefer to write to me in Japanese, you're more than welcome to do so, and I will respond to you in Japanese. Please note that during the program, I will be conducting the program in English. I will not be speaking in Japanese. But if you have any questions before the program, I'm more than happy to answer questions in Japanese if you would prefer. So again, please don't hesitate to contact me with any questions. and I look forward to receiving an application from you. Thank you.